Well, before I decided to become a GNP, I used to tell people that I was a jack of all trades and a master in none. My hospital experience was at the University of Minnesota hospitals, where I worked in coronary care, I worked in medical intensive care, I worked in neonatal intensive care, and I also worked on the float team, so I did a little bit of everything. A lot of experience there, and I learned a lot. Mostly I learned what a sick patient looked like, and that's important in working as an advanced practice nurse. One of the other positions I held at the U was a research nurse clinician, where I worked with a research group that was headed by Dr. J. Cohn, where we studied heart failure and pulmonary hypertension. And I have to say that, first of all, in long-term care, I took care of a lot of patients with heart failure. And that experience working in heart failure research, I learned so much about the pathophysiology of the disease and also the pharmacological treatment. And I used that information that I learned there at least once a day working in the long-term care setting. I also worked as a public health nurse, and what that gave me was a perspective of what it's like to be an elder living in the community in their home setting, which presents a different picture than the patients that I cared for in long-term care. But it also gave me perspective on where they came from and why they needed to come to live in the long-term care setting. All in all, I think that at one point, working as a nurse practitioner, I relied on something I learned in every job that I ever held. And so, because of that, I have to say that the more experience that you have as a nurse, the better prepared you're going to be to enter that advanced practice role and work as a nurse practitioner. The more experience, the better.